We begin with breaking news tonight. A North Texas doctor is in custody accused of contaminating IV bags. Investigators believe those compromised IV bags resulted in the death of another doctor and left several patients with severe injuries.
Several families have been demanding something be done and waiting on this arrest. There could be other victims as well. Officials at Baylor Scott & White Surgicare said they called police after they discovered the compromised bags at the outpatient center in North Dallas.
We have team coverage on this case, starting with William Joy in Dallas. He's been digging into this story all day. William?
Yes, Cynthia, this is the Baylor Surgicare Center where Dr. Raynaldo Ortiz Jr. worked as an anesthesiologist and allegedly contaminated those IV bags with a painkiller. In June, there was another anesthesiologist who worked here who took an IV bag home to treat herself for dehydration. She had a cardiac event and then died. The medical examiner said it was caused by an overdose of bupivacaine, a painkiller. And when tested, several of the IV bags had bupivacaine in them. At least 7 people treated here also had severe reactions to the bags. Ortiz has twice been disciplined by the Texas Medical Board. In 2018, it was for failing to report a conviction where he shot a neighbor's dog with a pellet gun. And last month, he was disciplined for not giving CPR to a patient who needed it. I talked to a former federal prosecutor who told me cases like this are extremely rare and the severity and the sentence can vary a lot.
Kind of the category of crime is very different. You've got one where people are really just trying to mess with a business, or they're trying to negatively impact a business. They're not trying to hurt anybody. And that's where you see kind of the 3-year statute kick in. But then you have these more egregious ones where they're doing things for, and the motive is always the question here. They're doing things for a nefarious purpose that they don't care. Like it sounds like here, they didn't care if somebody died or if there was serious vital injury. And that's when you see it kind of jump up to the 20 years and life statutes.
Food and Drug Administration agents are right now investigating. Baylor said it closed the Surgicare for that investigation, allowing it to continue. Ariel Placencia spoke to an attorney for several of these patients who have experienced issue. Ariel, what have you learned?
Well, William, we now know of at least 7 patients who experienced severe life-threatening medical emergencies while undergoing routine surgical procedures at Surgicare. Attorney Bruce Steckler, who's representing the 7 victims, told me today that almost all of them are under the age of 40 and all of them are in relatively good health. He said their stories are very similar. They went in for a routine surgical procedure and then suddenly found themselves being rushed to a major hospital because they suffered respiratory distress and cardiac arrest. I talked to him after news broke of Dr. Raynaldo Ortiz's arrest.
It is astounding, stunning for any of them to think that someone did this intentionally. And obviously that remains to be seen, but that's what law enforcement's there for, and we're going to cooperate with them to get to the bottom of it.
Now, we also talked to the attorney representing the family of Melanie Casper, an anesthesiologist who had worked at Surgicare. She took a saline bag from Surgicare to treat herself for dehydration at home. Documents show when she gave herself the IV, she, quote, almost immediately had a serious cardiac event and died. Attorney Don Tittle told us today that Casper's husband is relieved to hear that progress is being made on the investigation. In a statement, the attorney said, quote, there really is little doubt that Melanie Casper's death was the result of an IV bag that had been tampered with. We have credible information to believe that over the course of several months, between 10 and 15 patients of the surgery center experienced a life-threatening medical crisis soon after receiving an IV bag. Now, Baylor Scott & White set up a dedicated phone line for patients with questions. That number is 214-818-2794, and we've also posted that over on our website, Izzy.